I told you there's a treatment for erectile dysfunction with almost a 90% success rate, even when pills don't work, and yet most men have never heard of it? I'm Dr. Evelyn Hartwell, urologist and pelvic surgeon, and today I want to talk to you about intracavernosal injection therapy for erectile dysfunction. I'll explain what it is, how it works, who it helps, and why it might just be the solution you've been searching for. So, what exactly is intracavernosal injection therapy, or ICI? Simply put, it's a treatment where medication is injected directly into the spongy erectile tissue of the penis, called the corpora cavernosa. Now, I know what you're thinking. Inject medicine where? But hear me out, it's really not as intimidating as it sounds. In fact, this was one of the very first pharmacologic treatments for erectile dysfunction, introduced almost a decade before Viagra even hit the market. Here's how it works. The medications used in ICI are called vasoactive agents. They relax the smooth muscle in the blood vessels of the penis, allowing blood to flow in and fill the erectile tissue. The result? An erection firm enough for sexual activity that usually lasts long enough to complete intercourse, often 30 minutes or more. The most common medications include alprostadil, also called PGE1, or combination formulas like papaverine and phentolamine, known as Bimix or Trimix. These combinations work synergistically, making them more effective than any single drug alone. The beauty of ICI is that the dose can be customized to your needs and response. According to studies and my own experience, the success rate can reach 90% in men who use it correctly. Compare that to oral medications like Viagra or Cialis, which work in about 60 to 70% of men. ICI is also effective for men who don't respond to pills or can't take them due to other medications, like nitroglycerin, or conditions such as diabetes, cardiovascular disease, or a history of prostate surgery. Who is the ideal candidate? Typically, we offer oral medications like Viagra or Cialis first. But ICI is an excellent option for men who have tried oral medications without success or experienced intolerable side effects like headaches, flushing, or vision changes. Research shows that 88% of men who failed Viagra or Cialis respond positively to ICI, have medical conditions like severe diabetes, vascular disease, or nerve damage, have undergone radical prostatectomy for prostate cancer. Up to 60% of men who were previously potent may experience erectile dysfunction within 2 years due to nerve injury. ICI can also help maintain penile tissue health in these cases. In fact, if you're not getting erections, whether at night or during the day after surgery, you can lose 1 to 2 centimeters of penile length in just 3 to 6 months. One study showed that men who used ICI 3 times a week for 12 weeks after prostatectomy recovered spontaneous erections in about 67% of cases, compared to only 20% in those who didn't use any treatment. So if you've had surgery, getting erections early can make a big difference in long-term outcomes. Of course, ICI isn't for everyone. Men with sickle cell disease or other blood disorders, a history of priapism, prolonged painful erections, serious psychiatric conditions, or those who can't perform the injection themselves due to vision or physical limitations may not be candidates. You might think that men who respond well to oral medications would never use injections. But surprisingly, over half of these men who try ICI choose to continue long-term. Why? Better penile rigidity and fewer side effects. Now, let's talk about the most common concern: pain. Most men are surprised to learn that it's not as bad as they imagine. In large studies, about 50% report some penile discomfort at some point, but only 11% experience pain during any single injection. When it does happen, it's mild, around 2 out of 10 on the pain scale, and only 6% discontinue treatment because of it. The reason it's not so painful is that the needles are very fine, similar to insulin needles, and injections are given at the side of the penis, where there are fewer nerve endings. The process takes just a few seconds, and many men are amazed at how manageable it actually is. What about long-term use? Studies following men for over 8 years, and some even for 20 years, show consistent improvements. Penile rigidity can improve from 41% before treatment to nearly 90%, and sexual satisfaction scores rise significantly. Overall, 88% of men are satisfied, and 94% say they would recommend it to a friend or family member. Most men use ICI about 4 times a month, often privately, without needing to involve a partner. Complications are rare but can occur. The most serious is priapism, a painful erection lasting longer than 4 hours, which requires immediate emergency care. Other side effects include mild bruising, 7 to 33%, temporary penile pain, 12%, fibrosis or plaque formation, 2 to 10%, and some curvature or length loss, 20 to 27%. Most of these issues are rare and preventable when injections are done correctly. So, what does the process look like? If you're considering ICI, you'll work with a urologist or sexual medicine specialist. The first dose is given in the office, so your blood pressure and heart rate can be monitored, and to make sure you don't develop priapism. You'll learn how to inject, clean the area, and find the correct dose to achieve a firm erection safely. The goal is always the lowest effective dose that allows sexual activity without risking complications. Never inject more than once in 24 hours. Medications like Trimix and Bimix usually come from compounding pharmacies. Alprostadil is FDA approved and may even be covered by insurance. The bottom line, intracavernosal injection therapy is a highly effective, time-tested treatment for erectile dysfunction with success rates nearing 90%. It works when pills fail, can be tailored to your needs, and has helped countless men maintain sexual health and confidence for decades. Yes, the idea of an injection may feel intimidating at first, but in reality, it's far less painful than you imagine and provides superior rigidity and reliable results. If you found this video helpful, do me a favor, hit that subscribe button. It's free and it helps support the channel. And as always, take care of yourself, you're worth it. For more tips on men's sexual health, check out related videos on maintaining penile health after surgery, preventing penile shrinkage, and natural ways to improve erectile function. You can also explore guides on improving blood flow, nitric oxide boosters, and lifestyle strategies for better sexual performance at any age.